How does radical nephrectomy affect sexual function? Imagine going through surgery to remove a kidney because of cancer and wondering how it might change your life in other ways. Radical nephrectomy, which involves removing the entire kidney, is a common treatment for kidney cancer. But it can also influence aspects of health you might not expect, like sexual function. Research shows that men who have a radical nephrectomy are about 3.5 times more likely to develop erectile dysfunction compared to those who have only part of the kidney removed. This is because removing the whole kidney can impact kidney function and overall vascular health. When kidney function declines, it can lead to conditions like high blood pressure and metabolic issues, which are known to increase the risk of erectile problems. Interestingly, the onset of erectile dysfunction after a radical nephrectomy often happens several years later, averaging around 6 years after surgery. Studies that compare sexual health before and after surgery reveal that nearly 30% of men who had a radical nephrectomy develop erectile dysfunction afterward. In contrast, only about 10% of men who had a partial nephrectomy, where part of the kidney remains, experience similar issues. This suggests that preserving more kidney tissue can help protect sexual health. The link between kidney health and erectile function is tied to how well blood vessels work. Erectile dysfunction is often a sign of endothelial dysfunction, which is common in people with chronic kidney disease. When kidney function drops, it can cause problems with blood flow and vessel health, leading to difficulties with erections. Because partial nephrectomy tends to preserve more kidney function, it may reduce the chances of developing these vascular issues. Fortunately, many men who experience erectile dysfunction after nephrectomy find relief with standard treatments like medications that improve blood flow, such as sildenafil. About 63% of men report improvement with these therapies, regardless of whether they had a radical or partial nephrectomy. From a kidney cancer treatment perspective, these findings highlight the importance of considering not just removing the cancer but also maintaining quality of life. When possible, doctors often recommend partial nephrectomy because it helps preserve kidney function and may lower the risk of long-term complications like erectile dysfunction. It's important to remember that each person's situation is unique. Risks vary based on individual health factors, and decisions about surgery should always be made in close consultation with healthcare professionals. Patients should be fully informed about potential long-term effects on sexual health as part of their treatment planning. Always seek personalized advice from your medical team to understand what options are best for you.